Dr. J.Vimala, Senior Consultant Cardiologist at Sundaram Medical Foundation, Chennai. Now talking about heart disease are varied and occur from childhood to old age, and it's one of the most common causes of death in the elderly. Now coming to the common cardiac cause of death in the elderly is heart attack, as we all call it, and in medical terms it's called as myocardial infarction. Myocardial infarction happens when there is a 100% blockage in the blood vessel supplying the heart muscle. But before this 100% blockage occurs, we can detect this earlier in earlier stages itself. So how do we do it? We have some screening tests like ECG, chest X-ray, echo, treadmill test, and CT coronary angiogram. These are some of the screening tests to detect the blockage in the blood vessel supplying the heart. Now, which is a definitive diagnosis? That is arrived only by doing a coronary angiogram. By doing a coronary angiogram, we can find out how many blocks are there in the three major blood vessels supplying the heart and what is the percentage of the blocks. And once we know which are the blockages and how many are there, we can treat by doing angioplasty or what can be called as a keyhole surgery itself. While doing an angioplasty, what we do is we cross these blockages by using a wire and we pass balloons over them and we dilate these blockages. And so as to prevent the elastic recoil of the blood vessels, we put in small slotted tubes called stents. These are the stents that we commonly used, angioplasty with stenting. But nowadays, with advancement in various technologies like rotablation and drug-eluting stents being available and multi-vessel angioplasty being done and CTO or chronic total occlusion being opened, that is 100% of blockage being opened by angioplasty, almost all of the patients can have an angioplasty itself, a keyhole surgery itself to help them instead of going for the major bypass surgery, which involves opening the chest and a long recovery period in the hospital and later at home also. So these are the advances that we have in angioplasty, and almost all of them can have keyhole surgery instead of open heart surgery. We do not need to really worry nowadays because angioplasty covers and helps almost all the patients. Thank you.